while we hear from our next speaker. And then after that, we'll put the questions out there. Thank you. Thank you very much. It was just really enlightening, and it opened my eyes up to a lot of things, and it brought back memories on a lot of things what you spoke about. So we're going to move on now to our next speaker, who is Dr. Kristin George. And she is a consultant nephrologist and renal transplant physician at Aster Whitefield, Bangalore, with an extensive training from prestigious institutions in New Delhi, Bangalore Medical College. A gold medalist in general medicine. She has expertise in kidney transplantation, critical care nephrology, dialysis, managing complex kidney cases, and with numerous research publications, conference presentations, and patient awareness and initiatives. She is dedicated to advancing nephrology care and education. So Dr. George, please enlighten us and welcome.
Thank you, Bobby, for those kind words. Very happy to be here amongst you all. At the outset, let me congratulate Kidney Stories Toastmasters for putting this amazing program together. All those who are behind it, and Shobha Rao in particular for having me here. I hope my slides are visible. So in the next 10-15 minutes or so, I'll try to throw light on certain important and very commonly asked questions by our patients and caregivers, which Bobby has kindly shared with me. To begin with, this is a very common and very important question that we are faced with. How is my life going to be after transplant? For me and for my caregiver. So I think the most immediate and most obvious change that is going to be there is no more dialysis. So after a successful kidney transplant, when the transplanted graft kidney starts functioning immediately, there is no need for dialysis. Of course, there are few clinical situations wherein the kidney may take some time to kickstart, but by and large, in most of the situations, dialysis is not required. So next thing is the patient can drink a lot of water, unlike in dialysis where we ask to curtail water intake.
Dr. George, sorry to interrupt. Your slides are not moving.
Yes, 1 second. Is it moving? No? Okay, let me share once again.
Yeah, now I think it's okay.
Okay, I'll just share once again. Just give me a second. Are the slides moving?
We are at the second slide.
Yeah. I hope you can see this life before and after transplant, right?
Yes.
Yeah, so there is an improvement in the appetite. The patient starts to gain weight. So these are obvious initial changes that are visible. But again, the initial post-transplant period, there are a lot of new medicines, as Dr. Neerav was pointing out. There's a whole group of immunosuppressive medications that you're put on. So adherence to these medicines are very important. You're asked to take these medicines at a particular time in a particular dose. They are known to have certain specific side effects, which are again manageable, but it is important to be aware of these side effects. Frequent dose adjustments are required, especially in the initial post-transplant period. You are called to hospital frequently for blood tests, for adjusting medicines. Couple of patients do develop new onset diabetes after transplant, or the sugars in existing diabetic patients can really shoot up because of certain medicines which we give. Infection is always a looming threat, especially so in the initial post-transplant period where the immunosuppressive medications are given at a higher dose. So there are a lot of lifestyle adjustments. Those are required when you have to visit hospital frequently. At the same time, you have to mask yourself, avoid crowded places. You have to limit the visitors coming in. So these are changes which are required in the initial post-transplant period. And how this phase is managed is very crucial for good long-term outcomes. So definitely transplant provides an improved quality of life, longevity, improved productivity in both professional and personal life, although it requires close monitoring, medication adherence, and lifestyle adjustment. We are all familiar with certain famous personalities who have had transplant but are living fulfilling lives, and they are public figures. And back closer to home, he's a 12-year-old, Master Varun Anand, who received a kidney transplant and won 3 gold medals at the Transplant Games held at Perth, Australia in 2023. And on the right-hand side, you can see he's a famous neurosurgeon, Dr. Arjun Srivastav, who received the kidney from his brother who's standing next to him. And they are now crusaders for organ donation, traveling all over the world. So transplant definitely gives a new lease of life, and you can lead fulfilling lives after transplant. Now, coming to another common query that a lot of patients have is about rejection. So in transplant, what we do is we take an organ from a donor and put it in the recipient's body. So the body automatically recognizes this as a foreign organ, and it will mount an immune response to reject the kidney. That is natural mechanism. So we give immunosuppressive medications to prevent this rejection. And despite all the medications and despite all the cross matches, sometimes the body can still mount an immune mediated response to the transplanted kidney, which we call as a rejection, which is not uncommon. So in current scenario, with the current availability of immunosuppressive protocols, still we see around 7 to 10% acute rejection in the post-transplant setting. And but what is important to understand is that the majority of acute rejections are treatable. So it is important to detect them early. So we do a early transplant biopsy, graft biopsy, to detect these rejections and treat it. So when treated adequately at the right time, majority are treatable. So this is not something to be really scared about, although we do take all precautions to minimize the risk of rejection. Now, coming to another important aspect of role of caregiver. So it's very important, especially so in the early post-transplant period, wherein a lot of changes are happening physically to the recipient, a lot of lifestyle changes you have to do at home. And many times it becomes challenging if the donor himself or herself is the primary caregiver. And it could be emotionally draining if the graft function or the transplant kidney function is suboptimal, and if the recipient faces early graft rejections. And again, frequent hospital visits, many times the caregiver has to accompany in the early days. It could translate to loss of work days. So it is here that a thorough pre-transplant counseling regarding what to expect and how the course is going to be can make a huge difference. And social workers and dedicated counselors can play a very important role. And patient advocacy groups, forums like this, wherein we discuss what to expect and how the course is going to be, it can provide a huge support system. Now, coming to what are the long-term complications post-transplant? So we all know a majority of our patients are diabetics, hypertensives, and as age progresses, the risk of cardiovascular disease builds up. And some of the medicines which we give also contributes to, as I mentioned, diabetes, dyslipidemia, and all this put together increases the risk of cardiovascular disease. So periodic screening, statin therapy whenever indicated, in addition to putting or keeping your diabetes, hypertension under control, becomes very important. Infections are always a threat, more so in the initial post-transplant period, but it is a threat throughout your transplant journey. So it should be always a priority to get yourself vaccinated against all the vaccine preventable diseases, as Dr. Neera was also mentioning, that live vaccines cannot be administered in the post-transplant setting, but there are a whole lot of vaccines which are safe and should be taken. Another important aspect is cancer. Sometimes missed out or given less importance, I would say. But cancer is an important aspect, as Shobha Rao herself is a living champion for, for highlighting this particular aspect of how cancer can creep in a post-transplant journey. So regular screening is very important, which is gender and age appropriate, screening for skin cancer, screening for regular mammograms, pap smears, your stool for occult blood. Another important thing to not to be missed out is an imaging of the native kidneys. So we have sometimes come up with patients, after 10-15 years, they come back with a cancer of the native kidneys. The original kidneys develop an RCC, or a renal cell carcinoma. So regular screening, ultrasound, which looks at the native kidneys, also can pick up these early. And in cancer therapy, again, early detection makes a lot of difference. Another long-term complication is what we call as chronic allograft nephropathy. So in a simple layman term, you can call it as the aging of the transplant kidney. So what happens? There can be multiple reasons of chronic allograft nephropathy. One is chronic rejection itself. So in a long-term 10, 15, 20 years old transplant kidney, there could be a smoldering rejection because of various reasons like under immunosuppression. So balancing out immunosuppressive dosage to prevent rejection versus an over immunosuppression to prevent infections per se. So this is a very fine balance, and there can be a smoldering rejection which could lead to chronic allograft nephropathy, chronic graft failures. Another important cause could be recurrence of the native disease itself. That means originally the disease which damaged your kidneys could come back in the transplanted kidneys as well. This could be various autoimmune conditions like IgA nephropathy, FSGS, your C3GNs, and many more, which can come back in the transplant kidney. Again, a close follow-up can pick up these recurrences early and can facilitate early treatment so that it doesn't progress. Another important cause could be CNI toxicity. That is a group of medicines which we give, that is the tacrolimus and the cyclosporin. Themselves can be toxic if over a long period of time their levels are high, or it could interact with certain other drugs and cause toxicity. So these are some of the reasons for chronic allograft nephropathy. So another important aspect is to keep your diabetes, hypertension under control, because diabetes, again, if out of control, can again affect your transplanted kidney. Hypertension is a risk factor for chronic allograft nephropathy. All this also puts you at a higher risk of cardiovascular diseases. So maintain a healthy weight, follow a healthy diet and regular exercise plan, smoking cessation. All this can go a very long way in ensuring your overall health and also the health of your transplant kidney. I think this famous quote by Joseph Campbell summarizes the transplant patient's journey, that we must be willing to let go of the life we planned so as to have the life that is waiting for us. Transplant definitely provides us with a lot of opportunities, but at the same time, we have to be careful with our medications, with the regular follow-up and lifestyle adjustments. Those are required. Now, coming to the next question, this was put to me that whether there is any difference in kidney management between India and the United States. So what I would like to tell is here, the science of nephrology and transplant medicine is the same that we follow in India as which is followed in the US. The latest surgical advancements, including robotic kidney transplant, is being offered across major centers, including my center. We offer robotic kidney transplant. Immunological workup, including high resolution HLA typing, single antigen bead DSA, all the immunological workup that we do is more or less same. Immunosuppressive medications, what we use, are also similar to any large volume centers in the world. We transplant patients from other nationalities who come to us. We titrate the immunosuppressive protocol according to the ethnicity and the risk profile. Our patients who get transplanted with us travel all over the globe. So now for work, for leisure, for various other reasons, people travel all over the world. We manage patients coming to us after getting a transplant in the US and other countries. So as I mentioned, immunosuppressive protocols are by and large same. But one difference could be the type of infections we see in our country versus that you see in the States are different. The antimicrobial sensitivity patterns, the kind of bugs and the kind of medicines that work against each bug are different. They are different. Each region has its own antimicrobial or antibacterial sensitivity, what we call. So whenever you have an infection as a transplant recipient, these factors should be taken into account. And in our country, majority are living donor transplants that we do. The deceased donor program is yet, I would say, it is primitive. We are working on it to promote the program of deceased donation, but still the majority of transplants that we do are living donor transplants. Haplomatch transplants, wherein the lower overall the immunosuppression could be lower compared to a deceased donor program. So these are some of the differences, but by and large, more similarities than differences. I would just like to highlight this gentleman, Mr. Krishna Ram Sharma, who completed 46 years of transplant and died at age of 70, and his brother was a donor. So we have patients who live long lives post-transplant. This is a single transplant which lasted for 46 years. To summarize, kidney transplantation provides improved quality of life and improved survival. Nevertheless, needs close follow-up, medication adherence, management of complications. Standardized immunosuppressive protocols and availability of latest surgical techniques have made transplant outcomes comparable across large volume centers globally. I think it involves a lot of cooperation, teamwork, and continuous learning, be it from our colleagues and more so from our patients, who sometimes teach us volumes that books cannot teach. And it's a continuous journey. I'm very happy today to be part of this program, and programs like this can bring more awareness. When we speak about it, we can dispel a lot of myths. And congratulations to the entire team. And I would be happy to take questions if any. This is my email ID.